Hi, and welcome to Focus on Health. I'm Jay Cohen, Director of the Winstead YMCA. We're happy to have you with us. As always, we like to talk about individuals and businesses and organizations in our wider community that are doing things to help keep themselves or the community healthier and active. And tonight, as always, we've got a wonderful guest. I'd like you to meet Dr. Matt Pagano, who's a chiropractor here in Winstead and a really active member of our community. And we're going to have another fun conversation tonight, I'm sure. So welcome, Matt.
Good to be here, Jay.
All right. I've had the opportunity to meet you in a number of different scenarios, probably most often in our Rotary. But throughout along the way, I've know that you're a chiropractor, and the chiropractic world has been around for a while, but I think a lot of people don't know quite that much about it and the value to health. So I don't know if you can kind of give us a little summary of what it's all about.
That could be a long discussion or a shorter one. Chiropractic is just over 115 years old. The practice of chiropractic got its start in 1895 in Davenport, Iowa, by a gentleman who understood the human anatomy and understood that the brain controls and coordinates all the functions of our body through a variety of means, and so he reasoned that the brain sends those signals down the spinal cord, and then the spinal cord branches and it sends signals out nerve roots, and those nerves branch like the branches of a tree, and through that means the brain can control and coordinate everything that the body does. He understood also the anatomy of the spine, and that the spine's made up of 24 individual movable vertebrae. So he reasoned that if there was some dysfunction through a variety of means, such that, and this is a huge oversimplification, but if one of those nerve roots got pinched, then very much like parking on the garden hose, the sprinkler's not going to work.
Sure.
If that nerve root gets pinched, whatever the brain is trying to affect, whether it's the moving of a muscle or the functioning of an organ, that precise control over that function's not going to be there. So he started essentially manipulating people's spines, and over the intervening 115 years, other practitioners agreed with his initial assessment, and luckily for the profession, a lot of research has borne out some of those initial basic premises. And so where we're at now is that it is the largest natural healthcare profession in the United States. One of the things we concern ourselves with is just facilitating and normalizing the basic function of the human body, as I just explained. So we seek to try to do that without the use of drugs or surgery, and thereby that's how we designate ourselves and are designated as natural healthcare providers.
So is it still considered like an alternative type of medicine?
Yeah, very much so. For the longest time, the catch-all phrase for naturopathy and acupuncture and chiropractic and massage therapy, and I'm sure I'm leaving something out. I know I'm leaving things out, but it was complementary and alternative medicine. So, someone may present with symptoms, and the answer to those symptoms is not necessarily, drugs. I mean, there's a time and a place for sure. Modern chiropractic is the practice of getting folks better in a way that I've just described, but we are held to a higher standard, obviously, than some gentleman 115 years ago who just thought he'd give it a whirl, so to speak. Modern chiropractic there's typically the chiropractic schools are accredited. You need a bachelor's degree, and then you go to chiropractic school. Chiropractic school is another 4 years on top of that. And whereas students in medical school would learn pharmacology, chiropractic students learn manipulative techniques and means by which we can affect the functioning of the spine and the nervous system. Additionally, chiropractors have many hundreds of hours of nutritional education, so we're very well versed in not only making nutritional recommendations for our patients, but also in intervening in terms of trying to counsel them making therapeutic lifestyle changes, which is becoming more and more appropriate as of late. Some of the latest governmental regulations or recommendations that were released even last week regarding cholesterol, one of the 4 basic interventions that a healthcare provider is meant to make now for somebody with high cholesterol is lifestyle and dietary recommendations.
Sure.
So, our practices, the practices that most chiropractors have, are very well suited to making that intervention because we have the education. Quite often we have the time to be able to sit and assess someone's diet and how they live their life, and we can make suggestions in that regard, and we can lower folks' cholesterol or lower their high blood pressure, help them lose weight without, as I said, the drugs.
That's excellent. Now, like you said, 115 years, it's come a long way, requires all sorts of education and training and standards. Do you still find people skeptical because it's considered alternative?
Yeah, I mean, some people are skeptical by nature.
Sure.
And so I find those folks equally skeptical of herbal remedies or naturopathy or acupuncture.
Or even traditional medicine.
Very much so, very much so. And then there's other people who don't quite understand chiropractic, but unfortunately all they've ever heard about chiropractic might have been as a result of an unfortunate campaign that was put forth by, unfortunately, the AMA in the 50s and 60s.
Okay.
And essentially it was a bit of a misinformation campaign. And in the late 90s, the organization had to atone for that. Essentially, it was found to be antitrust behavior, and where we are now, I like to believe, because I live it every day, where quite often in the course of me doing a physical examination and a workup with my patient, I may order blood work, I may get X-rays or MRIs. And often I find that I don't believe their problem that they come to me with is going to benefit from chiropractic, and so I will work collaboratively with a variety of healthcare providers. I will refer my patients to orthopedists or general practitioners or neurosurgeons quite a bit if I feel that the patient would benefit from their intervention more than mine.
Sure. Well, that's great. So have you ever gotten to benefit from chiropractic care yourself?
Yeah, I mean, that's, it's interesting. I was in undergraduate school and I was a biology major, and I was plainly in that pre-med track, and I was introduced to chiropractic in my junior year. And I've realized it kind of jived with what I already thought and some preconceptions I already had about what health and healing is all about, and how, we managed to evolve for millions of years without the intervention without introducing foreign substances into our body like pharmacology. Why suddenly do we need it now? And so I investigated chiropractic a little more, and then another interesting occurrence happened once I made the decision to go ahead with chiropractic. In my freshman year at chiropractic school, so that we may help upperclassmen in their studies, we're essentially assigned to an upperclassman as a student patient, so to speak.
Okay.
But the intention is for you to approach it honestly, and so I took the opportunity to really discuss with my clinician a lingering hip pain that I had for 5 or 6 years at that point, having been hit by a car when I was 16. And sure enough, he did the same workup that my very good orthopedist here back at home had done of the knee, and found that I had reasonably good range of motion, and there was really no compelling reason why I should still be walking around with pretty moderate to sometimes significant knee pain. But then he went a step further. He looked to the adjacent regions, and he looked at my foot, and he looked at my ankle, and then he came up and he looked at my hip, and he looked at my low back. And as it turns out, there was a pretty easily resolved problem with some scar tissue in some of the musculature around my hip, and 1 or 2 treatments, and I have not had knee pain in that knee pain since. So
That's wonderful.
yeah, having made the decision to, it was nice that my decision was somewhat confirmed for me.
Sure.
So
Well, that's excellent. And I'm sure you have plenty of stories of patients who come away saying, thank you.
yeah, I mean, I would like to believe that that I help the folks that come to me. Certainly, I get some good feedback, and at the same time, I'll admit that I don't help all the patients that come to
Sure.
me. But I think if you go into healthcare as a healthcare provider and you decide that what you're going to try to do is first and foremost help the patient, then it's a foregone conclusion you're not going to help everybody, because, as I said already, a lot of the times the way you're going to get that person better the quickest is to refer them elsewhere. So
Yeah. One funny thing that I've found over the years in various roles that I've had, I work with a lot of different local businesses, small businesses, whether I'm looking for sponsors or what have you. And one thing I found to be true throughout the years about chiropractors is that you tend to be good business people, particularly surrounding marketing and understanding, how that works. Whereas so many other business people I get involved with don't seem to have that. They know their business, whatever their content area is, but they don't really understand the business operations and marketing around it. But it seems that chiropractors do. Is that like a focus in school that you seem to get?
yeah, I don't think that it is. I mean, I if it was, I didn't benefit from it because when I first, I bought my practice here in town from a gentleman who wanted to retire, but. I made a lot of mistakes, and there were some pitfalls early on with advertising decisions that plainly didn't work out. So, I think a lot of chiropractors do grow their practice through word of mouth and referral, and I think that's kind of the best way to do it.
Well, that's great. Well, obviously we've got a great thriving practice which enables you to do other things. And I know one of those things you're involved with is the Litchfield Hills bike race, the tour. And so tell me a little bit about that and how you got involved in that.
Well, the tour of the Litchfield Hills, I've been initially the co-chairman. Now I guess I'm the chairman of the event. About